All right, all eyes are not only on the presidential inauguration, but also on the cabinet. And the South African Medical Association of South Africa is urging President-elect Cyril Ramaphosa to cut down the size of his cabinet and use the money for the benefit of the healthcare sector. So let's talk about how all of this then happens. And we speak to Dr. Mvuyisi Mzukwa, who is the South African Medical Association Chairperson. Thank you so much, Dr. Mzukwa, for your time. I mean, where do you believe, for example, that this money that may be saved if we don't employ more people into cabinet can be better spent within the healthcare sector?
Good afternoon or good evening to you, Bongiwe, and to your viewers, and thanks for inviting me. We are responding to the call by, the current, the president-elect and the other parliamentarians to say that let's come together and work with this government, and let's stop finger pointing and all these things. So the first thing that we thought is, where do we start? We start by saving money, where, and that money will go where it is needed most. And our thought was that the first thing that we need to do is to look at our cabinet and say we're a very small economy, and we also have a debt, to our GDP. We're paying, for every rand, we're paying about 72 cents to service our debt. And we thought it's a good opportunity for us to look at this cabinet size and say, as compare ourselves with complex economies like Japan, which has got about 19 ministers. Looking at Germany, very complex as well, got 15 ministers. You look at the UK, also very complex with fewer ministers. Look at the USA, which is 6 times more than this population. It's also having about 24 or so of ministers. So if we're at such a small economy, obviously we can also cut down the cabinet size. Not only that, we could also look at the number of the need to have deputy ministers, because we believe that if you've got a political head, you've got a technocrat, which is the DG, which could take, which always does the work, by the way. So we do think that we can save that money to attend to the challenges that we have, and that is shortages of medical personnel, doctors, nurses, physiotherapists, social workers, everybody. But also we've got other challenges like your infrastructure that is dilapidating, broken equipment. We've got primary health care, clinics don't have stock of medicines, all these things that need to be attended to by a healthcare system to provide that quality care that we always talk about.
And I suppose the issue of infrastructure, as you've just touched on it, is as big as hiring personnel, as well as you saying. Let's talk about the impact, that this has had over time, particularly when it comes to, offering the public quality healthcare. Well,
what has happened is that we have failed, first of all, in terms of healthcare outcomes, And secondly, we, even on our aid that we've been doing well, we are now starting to falter. The other thing is that we've got a problem of litigation. We are litigated because we are giving poor quality, and we are messing up because our healthcare practitioners are suffering from what we call burnout. We've got a problem of broken equipment and all these things. So the impact is that we are not providing high quality service to our patients. We are not addressing, that which we should be addressing, that of the health of the nation. So we are saying to government, the little that we can do, to save not only this part, but also only the issue of these commemorations that we do. Like, for example, this month, commemorating the youth, we're organizing events and all these things. But what does it mean to the public? Because we've got 42% of youth unemployed. What is it that we're doing? Who is commemorating this when people are not employed? So all these things, we need to look at ourselves and say, where can we save as a nation?
And I suppose then, when you think about that particular conversation, if we're still talking about saving, if we're still talking about, issues around infrastructure, if we're still talking about a need for the addition of more healthcare workers, it also then again goes back to this ongoing conversation around the NHI and the funding and also some of the other issues, especially pertaining to infrastructure.
You are quite correct there, Bongi, because if you look at the NHI, it's still a pie in the sky. We've been told by government that it's going to take decades, it's going to take many years before we see its implementation. So in the meantime, what do we do? Do we fold our arms and say we're waiting for the NHI? No, we're looking at other means of saving money and making sure that the cabinet is appropriate for our economy, and we can cut on many other issues and take it from there. For example, if you look at the packs of those ministers, it's quite a lot. I mean, to have a minister who's got two houses, one in Pretoria and the other one in Cape Town. I mean, all those things and the bodyguards and the cars and everything else, we do need to think about what matters most at the moment, and that is the health of the nation.
So I suppose then that forms part of the argument when you say that maybe a leaner government structure could not only yield a saving financially, but promote efficiency, accountability as well, maybe?
Exactly. I think it's always easier to monitor, evaluate and monitor a leaner government than having this bloated cabinet, which is in most cases becomes cumbersome, to do the monitoring and evaluation. That's why the president decided there must be a department that specifically focuses on evaluation and monitoring. But if you have a leaner government, it's easier to do that, and also like the issue of accountability. So it is important that we look at these things and be honest about this. And we can only talk about them now that we are starting, a new government, and say, let us start now and save money.
And I suppose, as you say, it's time for action, not finger pointing, and also ensuring that there are solutions that are put on the table. Thank you so much, Dr. Mzukwa, for your time. Do appreciate it. And let's see what becomes the priorities, and if you do get your wish of a much more leaner cabinet, and what does a leaner cabinet then look like? But also let's see then what takes place there. That is Dr. Mvuyisi there, who is with the South African Medical Association, and he's the chairperson there.